Hello, and welcome to English and Immigration, your source of information about Canada. On this channel, we're talking about Canada and we're revealing the facts and the truth about this country. Now, the topic of today's video is healthcare system. We're going to discuss the question, is the Canadian system the best, and how to use it. Now, you probably know that a lot of immigrants arrive to Canada and choose Canada because they heard that the Canadian healthcare system is really, really good. Now, it also surprises many immigrants that actually Canadian healthcare system is not the best. Now, why am I saying it's not the best? Canadian system has been ranked number 10 out of 11 developed countries. Number 11, the worst, is the United States. Now, why did Canadian system get ranked so low? And the answer is because of the wait times. The waiting time when you need to see a doctor or when you need to have a surgery. The waiting time is what made the system ranked so low. So even though it's not the best, don't get me wrong, Canadian system is still really, really good compared to many other countries' systems. So what's important is to know how to use it. And we're going to discuss one by one all the problems, most of them are wait times, and how to go and work around those problems. So problem number one are long wait times in the emergency room. If you go to a hospital and it's an emergency, suddenly you're waiting and you're waiting there for ridiculously long amount of time. 4 hours, 6 hours, 8 hours. Oh my God, shock. Yes, now why does it happen? It happens because your situation is not really an emergency when you're dying. If you're dying, like you're having a heart attack or stroke, it's considered a real emergency and you will be seen right away. If you're not really dying, it's not that of an emergency, they can make you wait for 8 hours. Yes, that happens, and how to work around it, how to deal with it. So first of all, if you live in a big city like Toronto or Montreal, Vancouver, if you live in the big city where there are not one hospital, but several hospitals, what you need to do is to know 2-3 hospitals. You can have their phone numbers and you can, before going to the hospital, you can call them. If you call them and ask that question, what is the wait time right now? And which one has the shortest wait time, that one you would go to. That's one way of working around it. Now, another way is if, and again, some provinces have it, not all, and there are websites. There are websites that would actually tell you what is the wait time right now at this and this hospital. So you go on that website, you look at all the hospitals, and you see which one has a shorter wait time. That's another way to work around it. Also, it's a good idea to know what time is the busiest time at the hospital. And don't go there during the busiest time. You won't be seen for hours. Wait until the least busy time. For example, before early morning, usually not a very busy time. I mean, things happen, accidents happen, but it could be that between 3 a.m. and 9 a.m. is the least busy time. So if you know this is the least busy time in your local hospital, this is a good time to go. You won't be made to wait. Another thing you can do, again, know the least busy days, usually midweek, and also the most important thing, know what represents the real emergency. If you think you're having a heart attack, it's a real emergency. Know the symptoms. Go to the emergency room. You'll be seen right away. So now, we're moving on to number 2. So the first one, we discussed emergency rooms. Now, number 2 are the long wait times to see your family doctor. Now, what do I mean by long wait time? I mean 2 to 4 days. So you're sick today, you're calling your doctor, and you're getting an appointment, not today, maybe even not tomorrow. You're getting your appointment 2, 3, 4 days from now. Now, that happened to me once. I had terrible back pain, believe it or not, and by the time I was able to see my doctor, the back pain was gone. I was lucky. So what you can do in these situations, there are places where you can see the doctor right away. Now, they're called walk-in clinics. Walk-in, maybe you just go in, sit down, you wait in line, you see a doctor. So you need to know a walk-in clinic nearest to where you live. Or maybe it's not a walk-in clinic, maybe it's the community health center. They go by different names. The point is a place where you can see a doctor right away. That's what you need to know. If you don't know, ask around, maybe ask your family doctor, ask a community center, ask people. Somebody knows about these places. So ask and find out, where can I see a doctor right away? So that's how you would solve this problem. And know the hours. Know what time they close, what time they open. Now, number 3, so far we discussed emergency rooms and we discussed walk-in clinic. Oh, that's funny. And now we're moving on to the next one is surgery. Now, if you need a surgery, you might be really surprised to discover that you have to wait. And sometimes you have to wait for a long time. It could be 2 to 5 months to get a surgery. Say, for example, you need knee surgery or like a hip replacement surgery or cataract surgery, ankle, shoulder. So it could be that you'll have to wait. What to do? First of all, get the second opinion. It's possible that you don't need that surgery. I know it sounds terrible, but find another doctor because you have months and talk to somebody else, another medical professional. You might not need that surgery. Also, if, say, absolutely you know you need a surgery, you're in terrible pain, nothing else working, you tried all other options, what Canadians do, some Canadians who have money, they go to United States and they get their surgery done right away because the United States system is different. You pay, that's it, you get the surgery done. So some Canadians do that. Okay, so that was the surgery. Now we're moving on. Problem number 4 is there are things that are not covered by the medical health insurance plans, the provincial plans. So you will discover that things like dental care for adults is not covered. You will discover that prescription medication are not covered. You'll discover that physiotherapy, ambulance, home care, psychologist services are not covered. Not covered means you have to pay out of your own pocket. So that's unfortunate. And if your or a family member is in poor health and you really need those services all the time, so what you can do is get a private insurance. I know it may come as a surprise, but a lot of Canadians do that. They get private insurance, and this way their medication is covered, the dental is covered, and they're just paying one monthly fee for that. So that's one solution. And the second solution is not really a solution, but it's something important to know. Medications have side effects. You may be prescribed a medication, but before you invest, before you buy that medication, it's a good idea to look at the possible side effects and what damage this medication can do. Because sometimes the doctor prescribes it, but then if you do your research, you look at what the medication can fix and what this medication can break, and you compare the two lists, and say you have a little like stomach problems and you get this medication, and the list of potential side effects include things like cancer or something really terrible. So do your research before you actually pay the money for the medication that can do actually more damage than good. Okay, so now, I'm gonna put here not covered. And we're moving on to the next problem and solution. And that would be doctor is there to help you. But when you go to a doctor and you tell them, I have this problem, I have this pain, I have this issue, what often happens is the doctor just says, oh, okay, sure. And they write a prescription. Is this the only option? Is this the only choice, is to get medication, medication, medication? You need to learn to ask your doctor, what are my options? There's a question that you need to learn to ask. What are my options? Because medication is one option, is one choice. There may be other choices. So ask that question, what are my options? Same thing, if the doctor says you need a surgery, ask that question, what are my options if I don't want a surgery? And get a second opinion. Find another doctor. I'll tell you, this is what happens. Sometimes one doctor says you need a surgery, the other doctor will say, oh no, you don't really need a surgery. So, second opinion. And there are also alternative treatments. Again, do your research, find out what are the alternative treatments for this and that condition. Okay, now let's move to the last one. So we got 6 on the list. And the last one is, let's say you're in the hospital, but hospital beds are not available. This is a terrible thing that could happen, is that you are literally in the hallway on a hospital gurney because there's no bed. Terrible? Yes. Does it happen? Yes. So do your research and find out about the dangers of actually staying in the hospital, and you would need to make a decision. Would you rather stay at the hospital in the hallway on the gurney, or would you rather go home and stay there? It may be safer for you to stay home. So that's one thing. And again, second thing, research your alternative treatments. We're going to talk about this just in a second, a little bit more. Now, as a new immigrant to Canada, you need to know a couple of things. And the first thing is so-called Healthy Immigrant Effect. Healthy Immigrant Effect. When immigrants just come to Canada, they are usually healthy or healthier than the general Canadian population. But 10 years down the road, the healthier immigrants, their health goes down and becomes the same as that of a general Canadian population. So from healthier goes down. It's called Healthy Immigrant Effect. And this is something that you need to be aware of. Your health, you need to take care of it. Now, the next thing as an immigrant you need to know is the so-called culture shock. Very, very often there's a confusion among immigrants because once they come to the country and they feel sad, they feel kind of depressed. A lot of times they would go to a doctor and doctor say, oh, you have a depression. But you don't really have a depression. What you have is a culture shock, and you're going through the second stage. We did a separate video on that. We'll probably do another one. A research culture shock, because culture shock should not be confused with depression. That's number 2. Number 3, the more patients a doctor sees, the more money they earn. So what that means to you is when you go to see your doctor, you need to be prepared. You have a short time. A lot of times you feel rushed. It's like, oh, it's already done? Only 5 minutes, only 10 minutes? I want to talk to my doctor. Doctor doesn't have time. So what you need to do is to learn to do your homework. You prepare for your visit, and you say, okay, I want to tell my doctor this and this and this and this. I want to ask this question, this question, this question. Bring a piece of paper. When you're ready, okay, doctor, this is my list. Your conversation will be much more effective. People do that. It doesn't matter if English is your first language or not your first language. This is the way to use that time effectively. So those are the things. So we already discussed, is the system the best? No. Is it the worst? No. It's a good system. You need to know how to use it. You need to know how to deal with those long wait times. And you need to remember that you're an immigrant. Don't just believe and trust everything. Your doctor may be a very good doctor, but sometimes you need to ask questions. And this is one more thing. The last thing we're gonna touch on here is the economic gap. Now, what do I mean by economic gap? There are Canadians who are rich and they're healthier than everybody else. Why are they healthier? Because they eat good quality food. They spend money on organic food. They also use alternative medicine. They use their doctor, but they also use alternative treatment. They get more choices. And also, they're more educated. And I don't mean the degree, university, or those kind of things. They're more educated because they take control of their health. And when they have a problem, they don't just go to the doctor and deal with the doctor. They go online and they start researching, looking for information about that particular problem. And because English is their first language, they can read and listen and understand everything about the problem for themselves and find the solution. So if you'd like to stay healthy, you need to do the same thing. Go online, do your own research. What's my problem? How do I fix it? Then your health will stay as good as when you just arrived to Canada. Okay, thank you for watching this video. Hope you enjoyed it and find it useful, and I'll see you in the next one. Bye.